Objectives of today's session are to describe the following: the need and importance of adolescent-specific health services, what is meant by health services, role of health service and healthcare providers, barriers faced by adolescents and youth when coming to health services. And further, to learn how to make health services adolescent youth friendly. Measures to improve quality of adolescent youth friendly health services. We can abbreviate this as AYFHS, that is commonly used. So, measures to improve quality of AYFHS. What is in service package of AYHS and suggestions for improvement. Now we move on to the basic concept. It is health improvement of young person, factors influencing young person's health, role of service providers, improving competence, improving coverage. So we will cover all this. Is there a need for specific targeted health services for adolescent and youth? If we take Sri Lankan statistics, we have a population of 20.4 million. Out of that, 4.8 million are adolescent and youth. So, we call 10 to 24 group as young person. So, we are having 1/4 of young person. And when we come to adolescent, 16% of total populations belong to 10 to 19. If you come to youth, that means 50 to 24 group, nearly 16% of population are youth. So, 1/4 of our population are young persons. So, they are very important. If you invest on childhood, you will get healthy adolescent. If we invest on adolescent, we get healthy adulthood, and that will carry on to next generation. That is the investment of adolescent health. So, we will have benefits through next generation as well. We have discussed about the main health issues like early pregnancy, lack of access to sexual reproductive health services, sexually transmitted diseases, other infectious diseases, mental health problems, violence and injuries, alcohol and drugs, tobacco use. These are major concerns, major health issues among adolescent and youth. And again, one thing we cannot forget is undernutrition and overnutrition. That means obesity and thinness or undernutrition. And also there are conditions like anemia, micronutrient deficiencies, lack of exercise, and nutrition is a main health issue among this group. We have discussed about the conceptual framework of adolescent and youth health. A life cycle approach. To be healthy within the life cycle is important. In addition to that, social determinants, digital determinants like national wealth, education, health, proximal determinants like risk and protective factors are operating on them. So that ultimately lead to health behaviors among adolescent and youth and health outcome. On top of that, policies, preventive healthcare, curative healthcare all affect the adolescent in healthy and having healthy behavior. So, what are the services preferred by adolescent? There are evidence-based data. Here, dark blue line shows that they need specified youth-friendly health services. Right. Next thing is from another survey, they prefer to come on weekends, whereas our services are usually on weekdays. What are the health services and contributors for AYFHS? Now we will move on to it. Health service means a service preferred by health worker to a patient aimed at preventing a health problem or detecting and treating one. It is often included as provision of information, services and counseling. adolescent-friendly health services or youth-friendly health services, that term was used in certain countries, are those with policies, attributes that attract young people to facility or program, provide a comfortable and appropriate setting for serving young people, meet their needs, and are able to retain youth for follow-up and repeat visits. So, it should attract, it should be youth-friendly, it should cater the needs of youth, and youth will come back to us and follow-up and repeat visits are conducted because of youth are coming to us. Young person and good health. This is in diagrammatic form. For we are catering for adolescent. Adolescent mean here young person actually, adolescent and youth. First thing to have influence on them is family, parents, sibling, close family members who are within their home. That is very important in ensuring adolescent health. Next circle is own family friends, teachers, religious leaders and others. That is also very important. Then third circle is coming. That is society that influence them after that. Society means not immediate society. We took a second circle. Musicians in the country, sport, film stars and etc. Fourth circle actually has a similar effect, that is politicians, journalists, businessmen and the key figures, that means policy makers of the country.